Video about how to care for your IV line at home with your pet. We like to send IV fluids home with our patients so that they can be safer and more comfortable with their owners overnight. Some basic rules about caring for your IV line is to make sure the bag is higher than your pet. If the bag is lower, then it will be more like a blood donation with the blood coming out and going into the bag. You also want to keep this chamber vertical so that air does not enter the line and go into your pet as well. A couple air bubbles here and there aren't a big deal, but you just don't want large lines of air going in. Controlling the fluid rate is achieved by moving this clamp up and down. So up, totally open, makes the drip go fast, and then as you curl it down, it goes slower, and then all the way down is to stop it. It's important to close the clamp before you do anything, such as change the position of the bag, move your pet, go into the car, or change the fluid bag if it gets empty. There's always a possibility that you'll drop the bag, and having it closed will stop any air from going in and any blood from coming out. So to change the bag, you just grab the bag that you were sent home with. You'll open the package and carry it. And of course, make sure your clamp is closed before you start anything. Pull off this blue tab and remove the spike from this bag. So that just pulls straight off. And then you'll want to aseptically, so make sure this stays nice and clean, insert it into your next bag. Give it a good little twist and push until you are through the seal. Then you'll turn your bag back up, hook it up again, and then change your rate to the prescribed drip. So we will send you home with a sheet like this, and at the bottom the doctors will fill out this drip schedule for your pet. It's typically 1 drop per second, 1 drop every 2 seconds. You'll just have to be patient and count that out. So if we want 1 drop every 2 seconds, then we're going to go move our clamp up and down until we get pretty close. We want 1 1,000, 2 1,000, 1 1,000, 2 1,000. So that's a little bit fast. 1 1,000, 2 1,000, 1 1,000, 2 1,000. That's a little bit closer. There. So that's 1 drop every 2 seconds, which would be a pretty good rate for this little girl here. Join us in the next video to figure out how to assess your catheter to see if it's plugged and how to break up a clot should that happen at home.